All right, guys. Hey, Dr. Sean here, and we're getting ready to head back down from our weekend seminar with Dr. Loomis in Chicago. And we had a great time, and we got to talk about really what we're doing and the power of what we're trying to do for everyone and how you're trying to impact lives. And I had a great presentation today. A good friend of mine, Dr. Nick Gatto and Dr. Keith Giaquinto, both gave some really powerful messages out there. And they both were talking about, what do you do to change lives? What are you doing? What is healthcare about? Where are we going with it? What's the purpose behind it? And, you know, it's not always about curing everything, obviously, but it's about trying to take people and to help them make their lives better. And we have a real dilemma right now going on in our current healthcare system, and it's all over the news. You can't miss it this week that, you know, everyone's up in an uproar again over, you know, what are we doing? Obamacare and the death of Obamacare and starting something new and where to go. And it's a little scary, I think, for people. It's alarming. It's something that people aren't really sure what to do. And with the way media is today, how do you know what to believe and what not to believe? You know, we get told that there's alternative facts and there's false media and fictitious media, and nobody ever knows anymore. And that's one of the reasons why I decided to do this little short kind of live segment for you guys, was to introduce this a little bit to you and let you know what the state of it is and where we're going. Now, obviously, we all know that our system needs overhauled. There's no doubt about that. It's in drastic need of an overhaul. But we have to be a little careful when we run around like the sky is falling, we're going to have millions of people uninsured, they're all going to die. All right, what did we do before Obamacare? We had millions of people uninsured and they all didn't die. And, you know, I've always thought about that. I'm like, well, what do we do with the 50, 60 million they said were uninsured? They had care. Now, did they have care where you and I walk into our doctor's office and we swipe a card and everything's covered? No, that didn't exist that way. They had more acute care, more, you know, catastrophe type care. Hospitals, things of that nature would offer care to them, and they still do. And that doesn't change. It hasn't changed. The government's got all kinds of programs in place. There's independent companies. You have Shriners Hospital and all these little independents that were out there looking out for people and children and all these people that are less fortunate than others. So this has always been in place. And we're in a great country throughout the world. We're one of the better countries you can possibly be in my opinion. But we have some flaws. We all do. Nothing's perfect. Nothing's exactly what it needs to be. But the flaws have to be seen in this way. And this is my opinion. I think we have to look at the big picture. And the big picture is what's wrong with our healthcare system. It's not that you don't have coverage. It's that the coverage you have is incomplete. You're having to spend more and more out of pocket, more and more per household, and you're getting less and less and less for it. So you look at that, you think to yourself, well, we'll use a good example being a gallbladder surgery, right? If you had something like that, it costs one thing to have a gallbladder removed in Chicago. It costs less to have it done in Springfield. It costs more to have it done in New York. It costs more to have it done. Now, that's free market and free enterprise, and I get that. But you can't have a free enterprise if you're telling everyone you have to buy this, because that's no longer free enterprise. Now you're sitting there saying, well, we want you to have the ability to charge whatever you want to charge if you're a doctor and do what you want to do, but we're going to make it a government mandate. And that's where you run into problems with this. If you're going to do a healthcare system that's in place for all the people to try to help all the people, it's got to be fair across the board. And it's a real dilemma. And right now, one of our problems we have is that what are we getting for the money that we spend? What are you getting for the money that you're putting into your healthcare system? You know, as a rule of thumb, the average family, the average individual in this country is going to spend $400,000 on their healthcare over their lifetime. All right, so you're looking at about $500,000. That's per person. Now you take that up a notch and you say, well, all right, well, how many people are in a household? 2.58 according to the U.S. Census Bureau. I don't know where they get the 5/8 of a kid, but you got 2.58. So you look at that and you think, all right, so we've got this group of people that roughly 3 people per household are out there, and each one of them is going to cost $400,000 to take care of in their lifetime. That's $1.2 million. Now, why is that a big deal? Well, what's the average household, not individual, household income in this country? It's $51,000 as of 2016. Now you look at that and you think, okay, $51,000, I got to pay off $1.2 million in debt? How? How can you do that? And then what am I getting for my $1.2 million? What am I getting for $1 million in care? What do I get? What's the big woohoo factor you get out of this? We don't live as long as the Japanese. They spend way less than we do, and they live on average 12 years longer. We don't get cancer cured ever. We don't ever see stroke go away. We don't fix heart disease. We don't fix diabetes. Alzheimer's has now leapfrogged diabetes as one of the top killers in the country. So these chronic degenerative conditions are getting worse and more prevalent. And all we're seeing is that, well, all right, then what effect does that have on the cost of health care? If we can't fix anything, then we end up babysitting it the entire time. And if you manage things knowing that you're not really ever going to fix them, well, then it's a black hole for finances. And this is a real issue that we've got right now as we're trying to figure out what to do, regardless of your political beliefs. As you're trying to figure out what to do, you want to take care of people that have pre-existings. You can't forget them. You just can't. You have to give them the best quality care you can. But the question becomes, is a out-of-date, tired, overworked type therapy, like you see in chemotherapy sometimes, is that the best choice? You know, it's ungodly expensive. It doesn't work that well. And I'll give you an example. I had a patient years ago, a gentleman that came to see me, and he had a certain type of cancer and tumor, and I don't treat those things. I just help the body to restore normal. I help the body to get back the way it used to be, or make their quality of life as good as possible. But he was bound and determined that he was going to do this therapy. Now, he came to me out of hospice. That's where he came from. He'd been told, go home. There's nothing left for you. Then all of a sudden, out of the blue, oh, well, there's this therapy we can do. But you got to go to, another state to do it, in a university. And it was a proton type therapy, and it's cutting edge. That's what the word you always hear, right? Cutting edge. It's cutting edge. It's going to make all these huge differences for you. And so he had me look at it. And I did some research. And I said, man, what I'm seeing on this has been around since 1940. I don't know how cutting edge it is, but they're basically going to use the same therapy they invented and used in 1940. What's it going to cost per treatment? $250,000 per treatment. He needed 3. And you look at that and you think to yourself, he had to get it approved through his insurance because they weren't going to approve it. And I remember the doctors at the time saying it's got a 50% success rate. 50%, guaranteed 50%. Well, it didn't work for him. So is he part of that? So this is what you're looking at. What am I getting from my dollar? So if you've heard me, if you've seen me on Fox's Good Day Marketplace in the morning, or if you've seen me on Rick Kirby's Weather 217, or you've watched me or heard me on the radio, I've been on House Call now for 18 years locally, or you've looked at our Facebook, or you're tuning in even today, you look at this and say, what's our motto? What are we doing? We're about restoring normal. We're helping people to restore normal function. The body, guys, has an intelligence, and it's foolish if you think it doesn't. But our current paradigm, our healthcare paradigm, is not designed to respect that. It's designed to dictate to it and tell it what to do. You ever wonder if and I'm not picking on doctors, we're just picking on the system. You ever wonder if you went to your doctor and said, hey, doc, what's a cup of happiness look like? How do you measure it? What borders does it have? What parameters? What things can we use to measure happiness? You can't, right? It's not there. So in that paradigm, then happiness does not exist. It's not real. It's in your head somewhere. It's a chemical reaction. And that's how they treat it. But that's not reality, is it? We know the body has a spirit or an energy in it that keeps it alive and functions it and gets it going. This is what healthcare needs to focus on, in my opinion. We need to focus and go back to our roots and get back to the idea of trying to prevent things from happening instead of constantly dealing with the fire once it's lit. Try to prevent the fire. But how do you do that? You go back to the root of everything. The body's trying to generate energy. It's trying to generate energy to deal with whatever stress is in its environment. Some of those stresses are mechanical. Some of those stresses are emotional. Some of those stresses are nutritional or dietary or chemical. You try to change that to rebuild the body. But until we change a very outdated healthcare system, it's never going to change. And you're going to keep flipping on CNN and MSNBC and Fox and all these things, and they're going to keep badgering and telling you how it's all broken and how this plan's better than that plan. And we're right back where we started. We heard this with Obamacare 8 years ago, and here we are again. Same exact thing. So you're in a decade of time, we got nowhere from it. We've got a very broken system that needs help and needs overhauled. And I'll leave you guys with this last little note here and kind of my thinking about this. To move forward, we have to recognize that the system we have in place, it's old. We don't realize that, but our current medical system has been in place now for over 100 years. Right? It was designed to deal with acute traumatic care and infectious disease. And there's nothing wrong with that. There's a lot of great skilled doctors out there that save lives. But that's not the leading cause. You listen to those things I just listed. Cancer is not acute. Heart disease is not acute. It takes 30 years to develop it most of the time. You look at stroke. You look at diabetes. You look at Alzheimer's, autism. None of these are acute conditions. None of these are infectious in nature. So we're looking at this thing, well, the top 5, 6 causes of mortality in our population aren't acute or infectious or traumatic. So we look at that and we think, gosh, if we're using a model that literally is a round peg and a hammer to deal with a triangle or a square, it doesn't fit. And I think that's why we see all the problems. So we need an overhaul. And I thought I would do this with you today. Try and put some of your mind at ease a little bit and think, okay, the main system that we're in, it's a black hole for finances. And I don't get a lot out of it. So you gotta take control of your life. You have to take back what you didn't even know maybe you lost. You have to learn, how do I take care of myself? How do I get my body stronger? How do I get it more resilient and flexible and able to balance it? And then maybe losing weight. It might be emotional stress being pulled away from you. It might be doing physical things to make you stronger or healthier, or just walking every day, buying a pet and loving it. Finding ways to give that body stability and joy again. And if you do that, guys, you'll get your life back. We do it every day. And I'll leave you on this note. One of my good mentors always told me, if you don't expect a miracle, they tend not to happen. But you got to be part of it. You can't just sit in your chair waiting for the miracle to occur. You have to take an active role in your health and claim it back again. And if we do that, stay out of the machine. That's how we do it, guys. I hope that helps you. I'm Dr. Sean. I'm heading home. Have a great, great weekend.